My name's Zelda. I'm a DDSO 1Q, Disability Development Support Officer. I've been doing that for, I think, 13 years this year. I'm here because I think people don't understand the disability sector. They don't understand the nuance of what we do. And because of that, I think we're at real risk of losing resourcing and funding that provides essential services to people. I think what people don't understand about this job is, although it's an entry-level job for many people, the skills that it demands evolve constantly so that you're doing more than just providing physical or emotional support. You're also understanding risk and safety. You're also coaching people. You're also understanding how their communities work and understanding how you can enable people to be included. It's much more complicated than people think. If I could sum up how I feel about the state of the disability sector in Australia, I'd say I'm terrified. There is such a negative impression that people have now about the NDIS. I think the discourse about the NDIS really threatens people with disability, and it threatens a sector which was improving and transforming people's lives, and now we're at risk because people's misunderstanding and because the NDIS has been such a mess. It's at risk of really destabilising people's lives, and I'm terrified for the people I support. The NDIS ideally was supposed to relieve people with disability of the onus of organising their own supports and services. It actually doubled and quadrupled the amount of attention that getting those supports needed. It's insane. Don't want people with disability to feel as though they're being pushed towards living a life for the convenience of the service that they are using. They are supposed to be the person who is in control of their lives, but people, especially in group homes where I work, have never been less in control of their lives than ever before. If I could speak to the government, I would say there needs to be more understanding that the services we provide for people who are extremely vulnerable, whose communication and behavioural needs are quite complex, risk falling apart if we don't have funding and support systems that aren't tethered to NDIS pricing, which is inadequate, and to the NDIS's constant plan re-evaluation system that is taking attention away from people who need it and putting it on a bureaucracy that doesn't care.